On Thursday, we told you about Republican plans for health care should Obamacare be repealed and replaced. Tonight, our chief national correspondent Jim Angle looks at how the GOP plans to pay for their ideas.
Part of the effort to repeal and replace the president's health care plan, as Republicans see it, is to find a way to help the uninsured buy insurance. The president relies on a stick, the mandate, to force people to buy insurance. Republicans have a different approach.
Many on the other side see that there is an alternative if we actually use carrots and provide the right incentives for people to want to buy health insurance and actually give them more choices for the health care coverage that they think is valuable to them.
Republican lawmakers argue you can't have millions of uninsured in the country without creating chaos for the health care system, so some analysts propose tax credits to help people buy insurance.
I think we ought to have a tax credit of about $2,500 for an adult. I think a family of 4 could get about $8,000, and that would buy the core insurance that we want everyone to have.
It gets us closer to universal coverage than Obamacare does. This allows the 50 million individuals that are currently uninsured to be able to actually have the money to go out and purchase in a competitive market their own insurance.
Helping people who want insurance but simply can't afford it. Conservatives would take the $300 billion or so now spent to subsidize health care and simply turn it into what are called refundable tax credits, meaning people get the designated money even if they don't pay that much in taxes.
With the refundable tax credits, you can really have universal coverage.
One hope is to eliminate a bias in the tax code. Right now, everyone who gets health insurance through their employer gets it tax-free, while individuals and small businesses get no tax help.
That's not fair. It's arbitrary, and we need to have a level playing field.
If you're buying health insurance on your own, you have to use after-tax dollars to buy your health insurance. That is an unlevel playing field.
It's a very good idea for us to equalize the tax treatment of health insurance for those that are working on their own or in unstable work environments at a small company. We want to give them the same benefit that those of us have had for many years who work for much larger companies.
One question is how to structure the tax credits. Are they available just for the uninsured, or should they be used for Medicaid as well, which the president wants to expand by some 17 million? But it reimburses so little that the poor often cannot find a doctor.
A lot of folks right of center would like to see them eventually expanded into the Medicaid population so that you would have a tax credit and allow them to get off public insurance and go out into the competitive marketplace and pick the insurance that's best for them.
So Republicans argue this is a way to help the uninsured buy insurance without restructuring the entire health care system or raising taxes.